This is page 8 of the NRCME exam walkthrough presented by the DSG team. That's the DOT Study Guide team. Here we go. If there are any CNS tumors, that's central nervous system tumors, wait 1 year post-surgical removal if meningiomas, acoustic neuromas, pituitary adenomas, spinal benign tumors, or benign extraaxial tumors. Wait 1 year. Wait 2 years post-surgical removal of benign supratentorial tumors and spinal tumors. There's a maximum certification of 1 year if they're stable, non-progressive deficits, and the imaging shows no tumors. So once again, this can be hard for the folks who are just listening. You might want to use the visual supplement here. 1 year post-surgical removal of meningiomas, acoustic neuromas, pituitary adenomas, spinal benign tumors, or benign extraaxial tumors, but 2 years post-surgical removal if it's a benign supratentorial tumor or a spinal tumor. Remember, the maximum certification is 1 year if the stable, non-progressive deficit and imaging shows no tumors. Do not certify if there are primary or metastatic malignant tumors of the CNS or benign CNS tumors, which means they have not yet been removed. Now, if there's a diagnosis of dementia, do not certify. Dementia, don't certify. Static neurological conditions include things such as common cerebrovascular disease, head and spinal cord injuries, TIA with minimal sequelae, and strokes. Okay, so a TIA is anything with a duration of less than 20 minutes and at most 24 hours of symptoms, but with complete resolution of the symptoms. Now, if there's a TIA or stroke, most recovery from the stroke occurs within 1 year of the event. Wait 1 year if no risk for seizures, meaning the cerebellum or the brainstem is involved, or 5 years if there is risk for seizures, meaning the cortical or subcortical areas are affected. Maximum certification is 1 year with neurologic clearance. If there are hemorrhages, the risk for seizures is based totally upon the location, and it's the same weight and maximum certification as a stroke or TIA. Do not certify if a patient is on anticoagulants for a neurologic condition. Now let's talk about traumatic brain injury or TBI. And again, listen closely, look at the visual supplements. There are 3 classes. There's mild, moderate, and severe. The mild has no dural penetration or loss of consciousness. The symptoms are less than 30 minutes, so that's a mild TBI. No dural penetration, no loss of consciousness, and less than 30 minutes of symptoms. The moderate TBI has no dural penetration, but it does cause loss of consciousness that lasts for more than 30 minutes, but less than 24 hours. So no dural penetration, but loss of consciousness more than half an hour, but less than 24 hours is moderate TBI. And finally, a severe TBI is a penetration of the dura. It actually penetrates the dura. There's a loss of consciousness more than a day, more than 24 hours, with a high risk for unprovoked seizures, which does not decrease over time. You need to wait 2 years, seizure-free, and off anticoagulants for moderate TBI without early seizures, or mild TBI with early seizures. That's a 2-year wait period. Then 5-year wait period, seizure-free on off anticoagulants if a moderate TBI with early seizures. There's a maximum certification of 1 year or 2 years if mild TBI without early seizures, and if neurologic clearance. And you simply do not certify if there is any severe TBI, history of severe TBI, you cannot certify. If there's a patient with MS and they have a normal exam, you can certify for 1 year with periodic monitoring required. So that's multiple sclerosis. You can have, if they have a normal exam, as long as there's periodic monitoring, they can be certified for up to 1 year, up to 1 year for multiple sclerosis. Disqualify if there's any sign of progression, any abnormal MRI revealing new